Thank you for tuning in to the NITC webinar. And today I'll be discussing some of the findings from a research project we just completed recently. I'll be talking about the socio-psychological factors, how they affect active school travel. This is a project involving collaborations between researchers from University of Oregon, UNC, and then involve partnership with local schools and local safe route school programs in the Oregon mid-sized community. Today's presentation consists of 4 parts. I'll begin with discussing the research context, basically talking about why do we care about children's school travel, current state of knowledge, and current public campaign efforts, interventions, and the gaps in the research, and what motivated our research project. The second part, I'll be discussing the research objectives and goals specific to the project introduced in this presentation and what we hope to accomplish in this project. Part 3 will describe project design, implementation process, data collection, analysis, and findings. And I will conclude with part 4 with discussion on the takeaways for practitioners and researchers. So the overall background of why we care about school travel is become urgent as we understood how the travel behavior changed over the past 4 decades. As this recent report produced by the National Center for Safe Route to School indicates, there's a dramatic shift for children's school travel mode from 1969 to 2009. That's when the data were available. And you can see just within these 4 decades, students who were transported to school using personal vehicle increased from 12% to 45%, while children who walk or bike to school, the percentage went from 48% 4 decades ago and declined to 13%. And even though the other transportation means remains more or less the same. And this dramatic change happened particularly for children who live in short distance to school. For children who lived within 1 mile distance, that percentage of walking or biking school changed from 89% to 35%. For children who lived within 1 to 2 miles to school, the percentage of walking or biking school changed from 55% to 5.6%. So there's something going on here beyond just knowing that the distance plays an important role here. So what are the implications of school travel behavior change, this dramatic shift? There's 3 kind of things that literature have documented and then provided evidence. First is adverse impacts on travel demand and travel congestion. Obviously, school trips based on personal vehicles accounted for 5% to 7% of vehicle miles traveled. So this is increased travel demand. And approximately 40% of those who drove their children to school returned home immediately after a school trip. School trips based on personal vehicles accounted for 10% to 14% of all personal vehicle trips during the morning peak hour period. In some communities, in the morning rush hour period, 1 out of 5 people are driving their kids to school. There are also adverse impacts on the environment. Most of school travel trips are for short distance, 1 to 2 miles. Fuel efficiency, vehicle emissions are the worst for such kind of short distance travel. And also, automobile has become a non-point source water pollution major contributor to that. There are also adverse impacts on children's physical activity, health, and safety. So in tandem with this dramatic decline of children's active travel to school, trend, there is rising obesity rate among children. So the concern or the connection is that children, because of become more and more sedentary in their lifestyle, they do not have active activity incorporated in their daily life. That has caused less physical activities and also health consequences. And then additionally, traffic safety issue is very serious in some school zones, particularly close to schools in the morning when parents drop their kids at school. So there's a growing body of knowledge generated by research that's letting us understand what affects school travel. So currently we have identified factors associated with the built environment, factors associated with the social environment, some school policies, and then family and child characteristics. All these factors seem to work together, affect parents' decision to whether let their kids walk or bike to school. But there are some gaps in the literature. So far, most of the research, particularly in the planning field, has adopted what we call ecological model, which emphasizes on how environment interact with human beings to result in observed behavior. So most of the research help us understand the association between various environment factors and behavior outcomes, but they do not necessarily help provide explanation of the mechanism of how those factors work. Particularly a set of factors currently understudied is what we call the socio-psychological factors. So this group of factors characterize people's own beliefs, preferences, thoughts, as well as their perceived other people's attitudes and thoughts that can really explain or play a role in their decision making on what travel mode to choose when it comes to letting children go walk or back to school. And then some prominent psychological factors that we call attitudes or social norms, and using more of an academic definition, attitudes means people's beliefs about the likely outcomes of a behavior and an evaluation of those outcomes. So if you have a positive attitude toward the behavior, in our case, that's focusing on active travel to school, which means parents are more likely to have beliefs in the positive, favorable outcomes associated with using this behavior. Social norms means the normative expectation that one perceives other people might have. So what you think other people's approval or support for particular decision that you're making or behavior you're going to execute. So what we're trying to do here is to expand the existing ecological model for studying active school travel or active school commuting. Here we label it as ASC. Is incorporate the important social psychological factors into this model and help us understand the decision-making process of active school travel or parents' decision on what travel mode to use to let their kids to school. So this picture or this diagram shows an expanded conceptual framework that's informed by several important theories developed in the psychology or social psychology field that incorporates the two important constructs, social norms, attitude, into the process of how they interact with environment and then parent and child's characteristics to explain the probability of the children walking or biking to school. Here, the focus is on these two social psychological factors having direct effects on the behavior outcome. So when you have when you have certain environment factors comparable among two individuals, the ones who have stronger social norm and have more positive attitudes toward ASC, those individuals more likely to let their kids to walk back to school. So that's the direct effects. These two factors may also have indirect effects, which means even within the similar environment factors, the stronger norms and then positive attitude could make certain environment factors become more effective. So for example, parents who have very positive attitude toward ASC might be able to more likely or more willing to negotiate the environment. So even living in a longer distance or living in the places with lower walkability levels, they are still likely to let their kids walk back to school. So this is what we call the indirect effect. So with the ongoing research and then the better understanding of what factors affect active school commuting, at the same time, we have a very strong public campaign to encourage active school commuting among students and children. The most prominent or well-known efforts in the U.S. is the Safe Route School program. It adopts a systematic approach to promoting active school commuting, and it has the U.S. Congress has appropriated $1.2 billion in the last 20 years, and then invested in more than 40,000 schools nationwide to help in the hope to reverse the declining trend of using active school mode, active transportation mode to school. Internationally, there are also other efforts or interventions. For example, walking school bus program, cycling programs, walk to school day or walk to school week, school travel advisors and classroom programs. Those are the interventions or efforts being adopted in the UK, Australia, Netherlands, or those European countries. They have used many of these intervention efforts to try to encourage more students to walk back to school. Along with the more interventions being implemented in many schools, there is also a new line of research that's focused on the interventions. We call it intervention studies. Most of this research right now focusing on identifying the effects. So the question is, do the intervention work? In the hope that to generate evidence that can inform the debate of the costs and benefits of those interventions. But those intervention studies can also provide opportunity to help us understand the mechanism. How and why do those interventions work? But so far, the intervention studies have not actually focusing on studying the mechanism of behavior change for a couple of reasons. One is difficulty in coordinate research design, intervention design. Most of the intervention studies are mostly aftersort. So researchers become aware of intervention and then they then attempt to study the effects. In other words, the research design and intervention design were not coordinated in the early stage of the project or research process. The second reason is also that there's a lack of theoretic framework to guide the intervention design and to guide the data collection and the later analysis. So it is within this research context that we propose this research project that we're hoping to use the opportunity of conducting the intervention to better understand the mechanism of behavioral change, and particularly focusing on the socio-psychological factors. And then our objective also include to identify factors and strategies that can be used to enhance intervention programs' effectiveness. So the intervention that in the center of this project is called Boltage Encouragement Program. This is a program that gets its name because of a device called Boltage that I'm showing in the picture here. This is a device invented by a company in Colorado State, and then they have by now have about 50 schools in 5 states using this technology, this program, as hope to encourage kids walk back to school. So how a Boltage device typically works is by combining what we call sociology and technology. So in terms of sociology, is using incentives to reward children's active school commuting behavior, and then using the understanding of what we call the social learning process, the peer influence, hopefully to hope that children will learn and trying to imitate this active travel behavior, and also use incentives as a understand that as a recognition of their good behavior. The technology part here is basically a solar-powered RFID scanner that has internet connection. So this technology allows the device to track children's travel behavior by reading a tag that children register to. And also the internet connection allows all the data to be transmitted to a server where all the information is stored, and the researchers can go on to generate aggregate level information, and then kind of track the behavior change for individuals and for overall school. So we decided to use the Boltage program because of kind of the factor that it's cool, it attracts the student attention, and also because the ability of this program or the device to help us collect kind of a constantly collect the data. So this is how we think the program will work when we design integrated intervention design with our research design. So this is a diagram you've seen earlier, where we integrated the 2 prominent socio-psychological factors, and then how they affect the active school commuting behavior. And then the Boltage program comes in here. We have 3 hypotheses regarding how this intervention will work. So the Boltage program will have impacts on the social psychological factors. So it will increase the social norm, and it will increase positive attitude. Beyond that, this program may also have independent impacts on ASC because of all the perceived positivity associated with the program, and then the publicity that's given to the program. And also, we hypothesize that the social psychological factors will have effects on ASA directly and indirectly. Okay, so I'm going to talk about the overall project design, implementation, and findings. So this is a quasi-experimental study that based on the Boltage encouragement program. We've run this from 2011 to 2014. And then we worked with 2 school districts in Lane County, Oregon. And then the target students are from elementary schools and then middle schools, and also their parents and guardians. That's we collect information from them and analyze what are the factors affect the decision making, and particularly how the social psychological factors play a role in that process. This study is experimental because we compared schools that receive treatment with schools that have not received any treatment. But it's not a true experimental study because we were not able to randomize the selection of the experimental school and control school. So we did our best to make this a quasi-experimental study by identifying control schools that can be paired with experimental schools. So in total, we have we had 4 experimental schools, 2 elementary schools and 2 middle schools. Each of them run Boltage programs for 1 to 2 years, and we were able to recruit 6 control schools where we did not have any experimental intervention, but we tracked the data and then we kind of collect the same information from both experimental schools and then control schools. This table shows the summary of schools included in the study. Like I said, we tried our best to match the pairs, and then, but obviously, given the limitation in the study area, it's almost impossible to find the perfect match. To implement the Boltage program, we worked with school closely. So it's very important to have school principal support, and then also have local advocates and the parents get involved in the process. We use posters, school announcements, and then take-home flyers to publicize the program, to let parents know how to register their kids. Parents can register kids online or by sending in registration form, and then the school staff will help register kids on in their program. And all the participation is voluntary. Parents can decide whether or not to let their kids participate. So this picture shows one of the posters we used. This picture shows the solar-powered RFID device. So each participating student receives a tag that has a long-digit number that links to student registration information that has their school travel distance, and basically school travel distance and some of the kind of a locational information like streets, intersections. Student who carries this tag with them, when they walk close to the RFID scanner, the scanner will read the tag number and then produce a beep sound, let student know that his number has been captured. And then once this number has been captured, the student log a trip in the system, and then we can identify who has walked back to school on that day. Obviously, this is an honor system, so we have no way to really enforce that student like not cheating on the system. But based on the conversation we had with parents, with teachers, and then principals, students have been really honest in terms of reporting or logging in their trips. We used multiple methods to collect data. Parent surveys, one of major data collection to collect data from parents. We used the typical standard Safe Route School survey forms, and then we modified the forms to include additional questions that specifically collecting information on parents' attitudes and then their perceived social approval and then support. So within that 3 years, we sent out more than 11,000 surveys, mostly through the schools, and then we had about 4,500 valid returns. So this is a return rate at about 40%, which is not bad. We also use the Boltage RFID scanner to collect the data. This data, I said, is online, and then we can use a different method to aggregate individual data of a school and for different periods. We also conducted focus groups with students. This is a great method to kind of engage with students and then hear about what they think about the program and what their kind of opinion about walking or biking to school. So in total, among the 4 schools, we only conducted focus groups at experimental schools. We conducted about 25 focus groups and then talked with about 150 students. And the student we interviewed in the focus group came from various grades, so there's a wide age group, which differences. And then we'll also conduct an interview with school principals, supporters, and the parents. So we interviewed most of the school principals to see how they feel about the program, and then talked to teachers and parents, and about 25 people that we interviewed. So now getting into kind of the performances, the findings of some data, all the data we have collected. So looking at the 2 schools that we worked with in the 4G school district, you can see there over the 3 years when we run the program, there are kind of a higher participation or registration rate in the elementary school compared to the middle school. Over the years, kind of the registration or participation rate remains consistent, although we have a higher trips per person that's documented over the years, and then participants seem to have a shorter homeschool or travel distance over the years. So just to kind of summarize what that 2 tables tell us, the participation rates remained more or less the same. The average ASC travel distance decreased over the years, and then average number of ASC trips per student increased. But the difference we notice is younger students. This is based on our interview focus group with the students of different age group. Younger students appear to be more excited about the program than older students. So the program appeared to have a greater impact on the elementary school students. And I will look at parent surveys and to see whether the data we collected through surveys help us identify any impacts that Boltage program has. So this is a table basically showing the based on the parent survey, the active travel rate change over the 3 years. And then you can kind of basically glance at the experimental schools. They tend to have lower active travel rate compared to control schools because of all the control schools, they are actually local participating schools in the local Safe Route School program. But over the years, there's a declining trend of the control schools in the active school travel rate, while the Boltage experiment schools, even though they have lower active travel rate, but their rate is kind of increasing, particularly for the middle school and then the 2 other schools. So just to summarize what we found out from the parent surveys, this kind of school level analysis. So the Boltage experimental schools exhibited some increases in active school commuting rates over the 3 years. The control schools had higher active school commuting rates but showed significant declines. So by the end of the project study period, the gap in active school commuting rates between the experiment school and the control school has reduced. So we also used parent survey data to analyze whether following the implementation of Boltage program, we can identify any changes in the social psychological factors. So we have a set of questions to measure each of the constructs that we are interested in this project. So we have 4 or 5 questions to measure social norm or social support. We have 6 or 7 questions to measure parent attitude. So what I've used this table to show is following the implementation of Boltage program, we see the 3 main items used to measure social norm: perceived school encouragement, perceived family friend approval, and perceived number of other families who use this active school commuting method. And then we'll look at kind of the changes for an experimental school and for their control schools. Mostly you can see that experimental school has kind of a unchanged perceived school encouragement. Oh, actually, this need to be switched. So just listen to what I explained. I think that I had made a mistake in the columns here. So it's an experimental school has increased perceived school encouragement, and they also have unchanged perceived number of families using active school commuting. But on the other hand, the control schools witness decline or unchanged kind of a social norm support measures. So this list of all the items that we use to measure attitudes in experimental schools, that we looked at how parents perceived whether ASC is risky or ASC is fun, or ASC is provides good social interaction opportunities, or whether ASC is good for physical activity, and then whether ASC is desirable. Again, I have to apologize, these 2 titles actually got switched. So for the experimental schools, we look at this column. There is all kind of positive change in terms of more positive ASC attitudes following the implementation of Boltage program. And for the control schools, you look at this column. Interestingly, there's some decline in how parents perceive the positive outcomes associated with active school commuting. So we then conducted statistic analysis to look at how Boltage program can impact parent use of ASC, kind of the probability of they let their kids walk back to school. Because a lot of the changes that you see at the school level might be explained by the changes in travel distance, neighborhood walkability, or changes in student characteristics. So the statistic analysis allowed us to control for those variables. So what we found is when you control for student characteristics, age, gender, school travel distance, neighborhood walkability, and parent education level, what we find out is a student in the Boltage school was 8 times more likely to use ASC, even when all other situations are the same, compared to student who did not, who was not in the Boltage school. Second is parents who perceived family, friend, ASC approval were 6 times more likely to let their kids use active school commuting. And parents who consider ASC desirable, this is an attitude measure, they were 2 times more likely to let their kids use ASC compared to parents who did not have that positive attitude. Again, we also found out that travel distance is the most important kind of a inhibiting factor that reduce likelihood of student use active school commuting. So 1 mile increase in travel distance might reduce the likelihood of ASC by 3 times. We also found out that when you have presence of Boltage program, that program appeared to reduce impact of students' age and gender on ASC. The existing research has shown that boys and older kids are more likely to walk back to school because their parents feel more comfortable letting them do so. But in our research, we found out if you have a school that has a Boltage program, the age seems to have a lower impact, and the gender also seems to have a lower impact on the likelihood of ASC behavior. This is consistent with our findings that because Boltage program make the younger children very excited about walking back in school, and so because of the student demand to want to participate in program and want to walk by school, so maybe the parents were willing to let their younger kids to walk back to school because of the Boltage program. We also found out that the Boltage program's impacts on active school commuting probability also varies, depends on the school commute travel distance. So what this diagram shows is that in the shorter distance, this is travel distance half mile, 1 mile, kind of a half mile increment in the x-axis. And then the y-axis shows the impact of Boltage program, the adding to the active school commuting probability. So if the student travel half mile to school, having a Boltage program will add 10% probability to their active school commuting outcome or likelihood. But as the travel distance increase, the Boltage program's impact declines. And when you have the distance beyond 1.5 miles or even 2 miles, there is very minimal Boltage program impact that you can identify based on the data that we have collected. So what have we learned from the study, just to summarize? The Boltage program displayed positive impacts on the behavior. This is based on our school-level aggregate analysis, where we see increase in the ASC rate in the Boltage participating schools compared to schools who did not receive the Boltage intervention. This is also based on the individual level analysis, where we see the Boltage student who are in the Boltage program school is 8 times more likely to use ASC, even though compared to a kid who in the control school, they would have similar age, similar gender, and similar travel distance and other family background characteristics. So our goal was trying to look at whether this program affected the social-psychological factors effectively. What we found is that the Boltage program affects some, not all aspects. For the attitude factor, the school level analysis we conducted and then demonstrate that after the Boltage program implementation, the parents increase their belief in the positive outcomes associated with ASC, particularly in terms of social interaction benefits, and then kind of the overall ASC desirability have all increased because of the Boltage program implementation. And then for the social norm factor, we found very limited impacts. On one hand, parents perceive greater school encouragement because of the Boltage program implementation, but there is no clear impact on whether the Boltage program have improved people's perception of social approval, which is understandable given the short periods of this program implementation, and also the kind of a general declining trend that's indicated by the control schools data, sort of a declining trend of the social approval of active school commuting. So the limitation of study, obviously, that we work on with a mid-sized community in Oregon, and then this small geographic scope limits generalizability of our findings. And then we weren't able to find a perfect match between the experimental and the control schools. And then there's always limitation in how we can best or accurately measure the social psychological factors. But nonetheless, the findings or the research provided insights for how we can better understand the decision-making process of school travel mode choice, and also give us some ideas how we can run intervention programs more effectively. So based on our observation of how Boltage program has been run in different schools, we identified several factors that are important affecting the Boltage program, which also means many other intervention programs, how they can perform in different schools. So finding suitable schools, so the school that's located in suitable built environment and that has good neighborhood context is very important to ensure sustainability of intervention program like Boltage program here. Two schools that we work with in the Bethel School District, because of the kind of a physical setting of the school, and then because of the travel conditions of major arterial roads around the school, that has actually negatively affected the Boltage program performance in those schools. The second factor is students need to have positive attitude toward walking or biking school, and then they need to have a strong interest in participating in Boltage program. This is mainly because of age differences. So what we noticed is for older students, older children, they kind of started to perceive some of the push of Boltage program as kind of showing resistance toward those kind of interventions. So they're not very receptive, at least at the beginning, to participate or to have the program in their school. So that's why, in general, we notice the middle school has a lower participation rate compared to the elementary school. And also, to run this kind of intervention program effectively, it's very critical to have support and resources from the school that school can devote it to the program implementation. We rely heavily on the school staff to help us collect data, to help us encourage parents' participation or registration of our students. So it's always kind of we have to understand the demand that placed on the school in terms of running the intervention programs. So in terms of factors affecting Boltage program effects, that also tells us, what are the things that we should be keep in mind, or what are the strategy we can adopt if we want to increase the effectiveness of intervention programs, like such as Boltage here. So targeting schools with small catchment area. So this is mainly based on our findings that the program's effects are the strongest when students have short travel distance to school. So particularly for students living close to school, shorter than 1.5 miles, intervention program are likely to have the strongest impacts. Obviously, targeting students of younger age, they are more easier to be express excitement toward the interventions, and then also they can sort of work with their parents to identify suitable approaches to active school travel. Also, targeting parents already exhibiting positive attitudes toward AIC, and then targeting parents who have perceived stronger social norm. This is based on our findings that when you have parents positive attitude and stronger social norm, their likelihood of letting their kids to walk by school is much greater, despite some of the unfavorable environment characteristics. Implementation strategies. What we noticed in this research is active school travel, even though we emphasize how it is a kind of individual-based benefits that we like parents to adopt this behavior because of the benefits to their kids in terms of physical activity and then in terms of other health benefits. But overall, in this process, what we notice is the social aspect of kids walking back in school is what actually most attracts students. So obviously, younger students, when they recognize they have opportunity to walk or bike with their friends, they are much more acceptive or receptive to the idea of walking back in school. This is even the same to the older students, the middle school students. So highlighting the social interaction benefits and also creating socializing opportunities in the program will definitely create, will have help implementing the program more successfully, and it will increase the program's effectiveness. What we have done in this pre-implementation process is letting students know that they will be able to have a pizza party at the end of the year, and then we later trying to encourage parents to organize walking school bus where they can walk with several kids together to go to school. So this is all kind of a help create that socializing opportunities. The other things we find out is since younger children should be the target of interventions, and then for many of them, travel longer distance is not a feasible solution, like using active school travel to school. So helping them work with parents to identify suitable approaches to AIC becomes necessary, and it becomes more effective. One of the schools that we worked with, as many students wanted to participate, so the parents and then their children and then the school worked out a solution. They let the parents drop their kids like 2 blocks away from the school. Even for the kids who lived far away from the school, won't be able to walk back to school. They let the parents drop their kids 2 blocks away from the school, and then allow those children to be able to participate. So, so if active school commuting or walking back in school need to be part of the school kids' daily life routine, so kind of a variable, more suitable approaches to this behavior should be identified or kind of worked out between parents and school. Another thing we noticed is coordinating with other strategies could increase participation. In our research design, we kind of purposefully chosen not to let the experimental school to be the ones that from the Safe Route to School programs, because we wanted to identify the Boltage program's effects. So in the future, I think for the purpose of increasing the program's effectiveness, collaborating with the local Safe Route to School programs and integrating some of the activities that Safe Route to School program already have will definitely increase the interventions the effectiveness and then make the implementations more sustainable. Finally, working with parents and then the community together is very important. The schools we worked with had different levels of resources they can devote it to the program. And then the school that had the most successful program are the ones that has the strongest parent support, and the parents willing to help spread out the words, and then parents are willing to sometimes help the school staff collecting registration forms and then kind of enter information online. So if we want to really lead to behavior change in the long run, I think this is definitely needs a social kind of a social change that needs community and then schools and work together. So that concludes the main content of my presentation. I have some acknowledgements here, and I'd like to thank the founder of this research project. So this project is being funded by NITC and also OTREC. And then we particularly appreciate the local civil school programs and the coordinators for their help, and then the school principal staff members for their help to implement this project. This project is mainly conducted by University of Oregon's research team that include a group of graduate students. And thank you for listening to the presentation, and I'm ready to take any questions you have.
Okay, thank you, Yizhao. It looks like we have a number of questions and we're pretty short on time, so I'll dive right into it. The first question, what happens when the incentives are gone? Are prizes realistic for schools to implement?
Yeah, so the prizes we have so far are pretty low-cost ones. So we give students kind of some goodies. Maybe some of the local kind of certificates or gift cards to local places where kids can play together. So for most schools, they may be able to continue to give out the incentives, and then the ones we are now looking at tracking a school, we no longer give out prizes. What I've noticed is at least the level of kind of a number of trips logged into the system appear to be the same. They have not declined dramatically. So so I think it's a question that we are still trying to find out because we don't have the data yet. I guess my answer is if the school want to keep the incentives, they can because they're low cost. And then even if the incentives gone away, they may be able to still keep that level of active school travel rate.
Okay, the next question, did the Boltage program include increased school staff monitoring of students arriving and leaving school? For example, increased crossing guards and or traffic enforcement in school zones, or was the program just encouragement based?
Yeah, this is a program is just encouragement based. We were hoping to kind of separate the effects of different interventions. So we kind of deliberately chose to not use the Safe Route School program schools because they tend to have those kind of interventions like enforcing of traffic rules and staff monitoring. But in the Boltage program, we did not have those things. This is purely encouragement program.
Okay, last one, and if we didn't get to your question, we will email you an answer after the webinar. But the last question, what other information did you collect to try to compare the intervention and control schools to ensure that they were matched well? What else could have been done with more time or larger sampling frame to work with?
So the identification of control schools decided, or kind of the selection of control school decided with the input from the Safe Route School coordinators. So the coordinators kind of give us an idea of how matchable different schools are. And then I have to admit the choice of using the CFL schools basically because they also have data constantly collected, and then that help us with the data collection process. So this is kind of out of limitation and convenience. If in the ideal situation that we were able to have a larger sampling frame, then we would be able to, we should consider schools that's matchable in terms of their catchment zone size, schools matchable in terms of social demographic background characteristics, and also even having some idea to assess or some way to assess parents' attitudes and then psychological kind of perceptions toward active school travel as a way to help us make the best match between the experiment schools and the control schools.
Okay, great. So this concludes our webinar. Thank you for joining us today. Thanks again to Dr. Yang for sharing your work. We're looking for your feedback so that we can continue to offer relevant webinars in the future, so be on the lookout for an email with a short evaluation survey. You can view other professional development offerings on our website, nitc.us. This concludes our webinar. Thank you and enjoy the rest of your day.